Hey everyone, it's Dr. Christina, and I just wanted to take a moment to introduce this video that you're about to watch. So, Dr. Jayne has been wonderful and recorded this video to share with all of you, and I just wanted to introduce her. So, Dr. Jayne did this video on hormones. Now, these hormones are specifically toward women's hormones, but they can be in relation to male hormones as well. Dr. Jayne is a doctor of acupuncture and oriental medicine. She is a board certified acupuncturist and licensed in Virginia. She specializes in women's health, and today she's going to go over a lot of information. So I want you to understand that you should probably get something to take notes with, whether that's your phone, your iPad, the good old-fashioned paper and pen. Do whatever you need to do, but do take notes because there's a lot of information. And make sure you pause, go back, re-listen, whatever, but definitely take notes. It's good stuff. So she's going to talk about what hormone imbalances are, what their signs and symptoms are, the Chinese medicine approach as well as a functional medicine approach, and then what we can do to help ourselves. So if you have any questions after you watch this, just give us a call, come in at your next appointment, shoot us an email, but we're happy to help you. And she definitely has classes that she's going to record in the future, and I'm excited to watch them because I know I'm going to learn just as much as everybody else is. Enjoy!
Welcome to Holy Hermones. I'm Dr. Jayne Dabu. I'm a doctor of acupuncture, oriental medicine, nationally board certified in acupuncture, and a licensed acupuncturist in Virginia. I'm also founder and CEO of Lotus Acupuncture and Holistic Health Clinic. And I'm also the founder and CEO of Lotus Health Initiative and Genesis Botanical Formulas. My doctorate is in women's health and endocrinology, as well as pain management and neuromuscular diseases. Now, I'm going to be speaking about hormonal imbalance as it relates to females. This is a topic that's near and dear to my heart. This is pretty much how my life ended up in Eastern medicine. You see, in 2005, I was diagnosed with a uterine cancer, and that changed the entire course of my life. And when I survived through that whole ordeal and that journey, it was a wonderful journey full of many gifts, I was called to practice medicine. So through cancer, I found my calling, and most of my patients I see now, they deal with a lot of hormonal imbalance, digestive issues. I see a range of symptoms, syndromes, conditions in Western medicine, all sorts of diseases. And while I help everyone, my specialty is in women's health. So tonight we're going to have a brief masterclass about hormones as it relates again to women's health. So preview of the Holy Hormones class. We're just going to go through a brief overview of hormones, signs and symptoms of hormonal imbalance, and causes of hormonal imbalance from a Chinese medicine and functional medicine perspective, and some easy tips of natural hormonal relief. So, what are hormones? So, they are basically your body's chemical messengers. They're produced in the endocrine glands, and these are powerful chemicals that travel all around the bloodstream, telling the tissues and the organs what to do. They also help control majorly bodily processes such as sleep, metabolism, reproduction, many more. So when you have a hormonal imbalance, you can have too little or you can have too much of a certain hormone. And even small changes, just small changes, they can cause serious side effects in the body. So it's like a recipe. If you have too little or you have too much of one ingredient, it can affect the entire dish. And hormones, they can fluctuate throughout your entire lifetime. It's normal and it's a part of natural aging. However, sometimes these endocrine glands, they can get the recipe wrong from time to time. So what are some signs and symptoms of hormonal imbalance? I'm just going to give you a list of some of these. It's a pretty long list, but I'm sure if you're female and you're watching this, you have pretty much experienced all this. So you can have irregular periods, heavy, missed, stopped, or frequent periods. You can have headaches, acne, loss of hair, darkening of skin. Sometimes you can have it around the neck creases, below the breasts, underneath the breasts, in the groin area. You can have weight gain, skin tags can also be another sign. Again, hot flashes, night sweats, any type of mood issues or mood swings, depression, nervousness, irritability, anxiety. We can also have issues with fatigue, tiredness, any issues regarding the muscles, weakness, stiffness, achiness in the muscles. You can have pain and stiffness and swelling in the joints. Perhaps you could even have increased or decreased heart rate. Sweating is another thing. Increased sensitivity to cold or heat. Sometimes hormones can also affect the frequency of bowels. So you can have constipation, or you can have more frequent bowel movements, even frequent urination. You can have increased thirst, even hunger. You can even have suffer from blurred vision. Some people have pain in the ovaries, pain in the uterus, cramping, menstruation pain, fibroids, cysts, decreased sex drive, low libido, pain during sex, vaginal dryness, vaginal atrophy, infertility, thinning hair, fine brittle hair or hair that's breaking off, dry skin, puffy rounded face. You can even have purple or pink stretch marks. So all of these are non-specific, and it doesn't necessarily mean you have hormonal imbalance, but if you've had quite a few of these and there are other issues going on, then usually all signs point to it, usually. But you'd have to speak to a licensed practitioner or a doctor to discuss your case. So what are some causes of hormonal imbalance? Well, as we all know, menopause can cause that. Sometimes primary ovarian insufficiency, pregnancy, breastfeeding, a condition called PCOS or polycystic ovarian syndrome, hormonal drugs, birth control pills, HRT, which is hormone replacement therapy. Any medications can also cause it. Cancer treatments like chemo, possibly even radiation, tumors, whether they're cancerous or benign, pituitary tumors, eating disorders, stress, injury, trauma. And sometimes you can have underlying conditions that can exacerbate hormonal imbalances, such as diabetes, thyroid issues, high or low cortisol levels, Cushing's syndrome, or perhaps even Addison's disease. And there's many other conditions that can also cause hormonal imbalance. Now we're going to talk about Chinese medicine and the causes of hormonal imbalance. So in Eastern medicine, traditional Chinese medicine, hormonal imbalance is closely tied to the concept of yin and yang. So although yin and yang are opposite of each other, they also depend upon one another so that they can function properly. So hormonal balance occurs when yin and yang interchange smoothly. And when they go from one to the other, they have to make room for change and transformation. So just as it's important for estrogen and progesterone to be balanced, so too should the yin and yang ratio be balanced in your body. So if there's too much or too little yin or yang in the body, imbalances will occur. And that leads to hormonal imbalance. Another theory in Chinese medicine is called the 5-element theory. So in 5 elements, as you can see here on the screen, we have 5 elements. Fire. Let's go ahead and draw here. We have fire. We have earth. We have metal. We have water. And we have wood. And with each of these, you have a yin and a yang organ. So for example, fire, you have the yin organ is heart, the yang organ is small intestine. With earth, you have the yin organ is spleen, the yang organ is stomach. With metal, you have the yin organ is lungs, and the yang is colon, or the large intestine. With water, you have the yin organ is kidneys, the yang organ is bladder, and with wood, you have the yin organ as liver and the yang organ as gallbladder. And as you can see, each of these elements all give birth and create the next element. So, as water goes to wood, wood goes to fire, fire goes to earth, earth to metal, and metal to water, and then water to wood. And each one can also control the other. It can also go in the circle here. And you can go ahead and keep controlling, and they can also go backwards among each other. So the opposite way. And if it goes the opposite way, it can also cause problems as well. So this is a 5-element theory in Chinese medicine. So let me give you an illustration here. So let's take someone who's sedentary and they sit too much. They have a poor diet. So they're likely to end up with heaviness and congestion. We call that too much yin in the body. Let's say even some edema. Edema is like swelling in the legs, in the lower part of their body. So when their blood can't circulate properly, there's a buildup of too many fluids, not enough yang, which is moving, to move yin. And this could cause problems like sore back, like I said earlier, could cause some problems with swelling in the legs, varicose veins, achiness, achy legs, piles, hemorrhoids, even painful periods can occur. So in Chinese medicine, the liver, which is right here, the wood element, liver, right here, the wood element, it's intimately connected to hormonal balance. And if it becomes congested, it won't be able to function properly. So you need to move. Movement is important. If you're sedentary, you have to move. So the liver can't process or biotransform these hormones efficiently. So then the body's going to feel out of balance and it will lead to hormonal imbalance. So in Chinese medicine, the liver is a very important organ. Now let's take another example. A woman that exercises too much and she doesn't have enough rest, sufficient rest. So let's say she's doing too much CrossFit, and if she's doing too much CrossFit, there's too much yang, because that's a yang activity. Running, marathon, it's too much. So when people do that, they end up putting too much stress on their body. This woman in particular, she'll stress her body out, she'll drain her reserves, and when a person's reserves, which are stored right here in the kidneys, adrenal, the water element. When that happens and she's overworking, things are running low. She could have symptoms such as tiredness, fatigue, low libido, poor appetite. That's very common. And the body can produce lower than normal levels of hormone. This is called yin deficiency. And that too can lead to hormonal imbalance. That can also lead to amenorrhea, no periods, or infertility due to ovulation problems. So these are just some ideas. The woman that's not moving, the woman that's moving too much. You even have people that have digestive issues that can cause problems here or even here. And these can also go back and affect the opposite direction. So these are just some ideas. Everything is interrelated in Chinese medicine. Nothing exists by itself. Everything coexists together. Now let's look at more of the 5 elements, the yin organs and the emotions. With this chart right here, it's basically showing the organs and how they relate to some of the emotions. So usually when we have our periods, we can suffer from some anger and resentment, irritability, moodiness, And when we're really out of balance, sometimes we can have a lot of anxiety. That can occur as well. Sometimes we worry too much. Sometimes we can be very sad. We can have some sorrow, some grief here. Sometimes we're lonely. We have a lot of fear. So when you're imbalanced hormonally, sometimes you can have all of these, just all of these emotions. Not a very straight line circle there, but all of these emotions. Really, most of my patients that are completely hormonally balanced after seeing them for several treatments, changing lifestyle, all of that, their demeanor is very balanced. And they know when they're off balance. So the goal of Eastern medicine, of traditional Chinese medicine, is basically to restore balance in the body. And acupuncture and herbal medicine are safe and effective forms of the treatment, which can promote a healthy equilibrium. So acupuncture has a very regulating effect on the body, as do the herbs on hormonal balancing effect. So if you have too much, then we bring you down. If you have too little, we bring you up, but always regulated. So acupuncture and Chinese herbal formulas, they play a very important role in regulating the menstrual cycle, also menopausal symptoms, balancing emotions, and basically promoting overall healthy organ function. So here, this is how we make our diagnoses. You may come to me and say, I have, let's say, painful, irregular periods, right? So I will ask you to please let me see your tongue, and I'll take a look at the tongue. I will also feel the pulse over here. So we'll take a look at the tongue over here, and we'll also feel the pulse on the right side and on the left side. And this is very important to check these out. You see, because 3,000 years ago, they did not have MRI, they did not have X-ray, they didn't have the technology that we have today. So as a doctor of acupuncture oriental medicine, the moment you walk into the room, well, before we were wearing masks all the time, I could smell the patient. And you're not supposed to wear perfume, but the smell of the patient also tells me what organ is out of balance. Not only that, but when we look at the tongue, we can tell obviously which organs could be out of balance depending on the shape of the tongue, depending on, how wet the tongue is, if there's any other features that look out of place in these certain areas, and they mean something. This is how we diagnose, and we choose the points, and also how we choose the herbal formula that's right for you. And also with the pulse, when we're feeling the pulse, it's not like Western medicine where we're just checking to see, does a person have a pulse? We count the number of beats per minute, but we are actually checking what these organs feel like: the lung, the spleen, the kidney, the heart, the liver, the kidneys. On the right side, over here, for females would be the state of the uterus and state of blood. On the left side for men, prostate, state of the prostate, and also the state of the chi. So this is very important. With the pulse, you can feel so many things. I can feel when a woman is ovulating. I can also feel also when they're pregnant, the sex of the baby. We can also determine that as well. And also when a woman is also on her period. Now, I didn't have a picture here, but we can also look at the ear, and that gives us some clues as to when a woman's about to start her period, which is very important. We're also looking at the face. The art of Mengsheng is also checking the face, the coloring, and certain areas such as up here, the forehead denote youth, those ages of youth and what was going on then. And certain other areas of the face will also tell me what was going on during those ages. So we're reading the body. We're also palpating, touching the belly. So we are doing a great observation in Chinese medicine. I'm even listening to your voice. Is it sing-songy? Is it sad? Is it moaning? Is it groaning? Is it loud? Do you sound very angry? So those denote so much to us as a doctor of Chinese medicine. That's why we spend so much time listening to you, asking you questions, observing you, and discovering some things about you, even things that you may not even know about yourself. Now, I also practice and integrate functional medicine. And functional medicine is a systems biology-based approach that focuses on identifying and addressing the root cause of disease. So with Chinese medicine, we're also checking the root cause of disease and all the interrelationships of all the organs. But we're also doing the same as functional medicine. The only thing is that our diagnosis in Chinese medicine is going to be the tongue and the pulse, right? Also checking the face reading, checking the ears, palpating, smell, all of that comes into play. The sound of your voice, telling me what your lifestyle is, all of that is very important to me as a doctor of acupuncture oriental medicine. But also from a functional medicine perspective, I'm also gathering this data as well. So we're gathering what's happening here. I'm asking you about your own diet, nutrition, exercise, trauma. What's going on over there? We're also trying to figure out right here, immune and inflammatory balance. What's happening? Is your immune system low? Are you inflamed? What's causing it? As you can see, all these arrows, they all are interrelated. What's the digestion? What's going on with the digestion? What's happening over here with the energy production? Are you under a lot of stress? Are you fatigued? Are you tired? Also, is your body able to detox? Are you constipated? Is your body able to sweat out toxins? What's happening structurally? Now, I don't treat structurally, but I can notice what's happening structurally with the body, and I'll usually refer out, like, for example, to chiropractic, massage therapists, physical therapists, DOs, even hormones and neurotransmitters. We're checking that too. And of course, as in Chinese medicine, as in functional medicine, also the mind, emotions, your community support. And in functional medicine, what makes it different is that I am also sending out for labs. And in the case of this, for hormonal imbalance, there are particular labs that I'll be using, usually adrenal labs, saliva tests, urinalysis, and sending them out to the labs, checking to see what's happening. Also, we're checking the neurotransmitters of the brain, what could be causing maybe some sleep issues, some mood issues, We're also checking usually digestion. Is there a little low-level gut infection that's causing some problems with the hormones? Is there something going on with detoxification that's causing the hormones? So these are the things over here that you are usually in charge and can, be aggressive with and start to take care of with diet, nutrition, exercise, right? I'm also checking, however, environmental inputs. Now, this might be mold exposure right here, environmental inputs. That can happen. Heavy metal, heavy chemical issues can also cause hormonal issues as well. But everything is so interrelated. That's why it's not so clear-cut when someone has hormonal imbalances. But if you've been listening this whole time, this is not just about hormonal imbalance, it's about imbalance of the entire system. So, what are some easy tips that you can do? All right, so I just put together a list of things that you can do. Obviously, as we all know, eat organic foods, hormone-free meats. See, if you can eat organic foods and hormone-free meats where possible, just know that, it's important to, because pesticides, chemicals, and hormones are used to treat produce and animal products. And they contain synthetic estrogen substances. And it can have negative effects on our organ and endocrine systems. With me, I had uterine cancer, so I was more estrogen dominant. Was I eating organic foods? Not all the time. I really wasn't at that time. It wasn't such a big deal 15 years ago, eating organically. Hormone-free meats, that didn't really come out too much, maybe in 2005. We knew about genetically modified foods, but it was talked about, but it wasn't so much in the mainstream. So when you have foods that are treated chemically and with fake synthetic hormones, it causes what's called xenoestrogen. Xeno, and it's spelled Xeno, which means fake estrogen. Looks like an estrogen structurally, but is not a real estrogen in the body, and that can confuse your body. So we also have to look into our cosmetics, our lotions, our toiletries that we as women put on our body all the time. If you could try to use as natural as possible. I always read the ingredients in all my cosmetics and lotions, and there's so many out there. I know EWG, Environmental Working Group, is a really great website to check things out. You've got to be careful with lipstick because it has metals in it, and you can have metals also with certain primers for the face. And my whole thing is I just read the labels. And if it's a long word that a second grader, first grader can't even spell or remember or doesn't even know what it is, then I just don't buy it. I actually like the company called 100% Pure based out of San Jose, California. And there's so many other places that you could check out. Another thing is obviously eat more cabbage, broccoli, Brussels sprouts, cauliflower to your diet. Because the thing about these is that these cruciferous vegetables contain what's called DIM, D-I-M. And you say it's pronounced indolmethane, DIM. And it basically helps to break down estradiol in the body, because too much estradiol, which is a form of estrogen made in the body, it can contribute to breast pain, to weight gain, moodiness, low libido, and breast and uterine cancer. So if you're eating non-organic foods and eating junk food and smoking over here, whoops, didn't mean to do that, then you could be adding more extra estrogen to your body. So you definitely have to make sure you eat the cabbage, the Brussels sprouts, all these here, cauliflower to your diet. And obviously avoid smoking. Now, I have here eliminate refined sugar, caffeine, nicotine, and alcohol. The thing is, I say eliminate. The reason why is because we overdo refined sugar. We overdo caffeine. We overdo nicotine and alcohol. So when a woman eats too much sugar, let's say premenstrual, her periods are going to be horrible. The cramping is going to be terrible. If she's stressed out, you're going to have irregular periods. Also, caffeine. Too much caffeine can cause fibrocystic breasts. Too much alcohol, that's also sugar. Now let's talk about a menopausal woman or perimenopausal woman. It can disrupt sleep, same with sugar, caffeine, all of this. And if you're already perimenopausal or menopausal, you're going to have sleep issues already, right? So we've got to help balance those hormones. It can also, if you're eating sugar, and I'm not just talking like a pastry. Like one of my patients was saying, oh, at night, after dinner and maybe even before bed, I have fruit and I keep eating so much fruit before I go to bed. And then she was wondering why she was having hot flashes. Well, it's too much sugar because she was more what we call in Chinese medicine yin deficient. Too much sugar before bed causing hot flashes and sweating throughout the night. So that's a little tip for you. And obviously try to sleep. Sleep as much as you can. If you need to take a nap, but you should probably see me, talk to me, because maybe you're taking a nap because your adrenals are tapped. You have kidney Qi deficiency. You might need to check, call me. Also, exercise is important. Sedentary people have lots of issues. And like I said earlier, and use the illustration of a woman that's sedentary. She could have low back pain. The best thing with low back pain is get moving. Okay, if you're too much in pain, then obviously go see your fellow chiropractor, doctor of chiropractic, come see me, get you out of pain so you can start to move. But in Chinese medicine, you want to start doing some yoga, some Tai Chi. These are the yin exercises here. Okay? Be careful overdoing too much running, too much yang, too much CrossFit, too much cardio. You may want to do some yin, maybe some weightlifting, some yoga, some Tai Chi. And obviously take time out. Take some me time. Take time out for things that you enjoy, like hikes, facials, pedicures, foot massages, read a book, meditate. That's to create more chi in your body. You need that space in a busy world. I always try to at least start with 4 hours a week to yourself. And obviously avoid overworking. You can tap out your adrenals this way. And while lots of people say, oh, you're a hard worker, that's wonderful. But if you're going to work hard, you also need to take very good care of yourself. Now here's some other tips as well. These are some of the most common supplements or nutrients and minerals that I see are lacking, especially in the standard American diet. Zinc is lacking a lot, so eat more foods rich in zinc. Magnesium, definitely vitamin B6 is so important, so helpful. Vitamin C, flaxseed, try to have ground flaxseed if you can, omega-3, and vitamin E, very helpful. These are the most common ones that I see are lacking in women and just people in general. You can also go to my newly launched website, Genesis Botanical Formulas, to purchase some of these. So over here I have Methyl Essentials. That has some vitamin B6, B12. Vitamin B6 is going to be wonderful for hormonal balance, especially neurotransmitters of the brain to help with mood. Also B6 will also, or B12 will also help with the digestion as well. Detoxification of any extra toxins in the body. Omega, triple strength here. We have BioVail Vitamin C Plus down here, and some magnesium powder. Made sure that this is buffered vitamin C for people that have weaker digestions. So these are very important. We have all these as well on that website, Genesis Botanical Formulas. Another thing, and I'm going to talk about it on the next page, is seed cycling. That's also good for a woman that is and premenopausal. Essential oils are very important too. So you could buy a diffuser, clary sage, bergamot. Those are well known and really great for female hormonal balancing. So check those out. Also, what I find, women do not get enough iron-rich foods. And just an idea here, a woman older than 19 years old should have at least 17 to 18.9 milligrams per day, at least. So you may want to think about that. You know, if you're having amenorrhea, if your hair is brittle, sometimes that may not be a thyroid issue. It could just be a nutrient deficiency issue. You also want to avoid BPA and phthalates in any of your plastic or cookware or anything that you drink from. I usually have something that's BPA free. I try to use glass as much as I can, and these phthalates can cause what we talked about earlier, xenoestrogens. Milk thistle tea is very important because that also helps with liver detoxification. So drinking some milk thistle tea is also great. Detoxification, I'll be coming out soon with my new Estra Cleanse to help a woman detox her liver. And not just that, but all the detox organs such as the bowels, the bladder, the kidney, the lymph, the blood, and also the liver, like I said earlier. So be on the lookout for that, and I'll have that on the website probably in the next few weeks. And also eating a lot of ginger and garlic. Ginger helps to warm the digestion. This is a very important Chinese herb, and it's a lot of Asian dishes have ginger to warm the digestion. And digestion is also very important in influencing hormonal health. Garlic's very good anti-inflammatory, and oolong tea is very good for digestion. Helps the metabolism of food. So these are some other tips that you can do. Now let's talk about seed cycling over here. Now for the premenopausal women, this is a really nice tip. So I'm going to say this is for let's say a 28-day cycle. So day 1 would be the first day of your period when you start bleeding, right here, day 1. You start counting then, the first day. So for the next 14 days, you want to start adding flaxseed into your diet to help increase the estrogen. And the flaxseed, you want to have ground flaxseed. And the pumpkin seeds, you also want to add another teaspoon daily. So flaxseed and pumpkin seed for the first 14 days. That would be called the follicular phase, right? And then day 14 is ovulation around that time. Again, this is based on a 28-day cycle. So if you have 35, then you have to go ahead and, switch this up. And then over here, the next 14 days after ovulation, you're going to go ahead and have at least 1 tablespoon of some sunflower seeds, maybe 1 tablespoon of some sesame seeds. This is really important as well. And this will help to boost progesterone. And now you're in the luteal phase right here. This is called seed cycling. Very easy and a very nice tip for you to try. And from acupuncture, these are acupressure points that you can also rub on. So if you have a little bit of pain, okay, let's start up here in the upper left-hand corner. This is called Union Valley, large intestine number 4, and it would be right here that we call the thenar eminence, the highest area, and you would press on that. If you have a lot of pain, that's also great for headaches. It's good for digestion, many things. Over here, as you know, this is PC6 pericardium number 6, and that's right inside the wrist, right around that area. And I'm sure you've heard of C-bands. They put the C-bands right there to help with nausea. They can also help as well. I use that a lot on pregnant women when they're nauseous in their first trimester. Right here, this, it's cut out, but CV, conception vessel number 17, right here, or REN, Another name for this is Ren. Ren 17 can also, that's between the two nipples of the breast and right in the center of the sternum. And you could rub that there, feeling some anxiety, some heart issues. And then over here, spleen 6, Sunyin Jiao, right here. That's basically above this bone and like about a hand width apart up here. Now, you want to press on that if you're also having some cramping, some hormonal imbalancing, even over here as well. That would be good. You can also come see me. We can do some acupuncture, help you with the pain. Now, this is also contraindicated in pregnancy. So on a pregnant woman, you do not want to press on that at all. And on the right side, here we have pressure points and reflexology. Again, if you're going to a reflexologist and if you're pregnant, they'll know. Obviously, always tell them if you're pregnant. But it would be great to go for some foot massages too. That's an easy way. And, you know, it could be something you do monthly. I think it's a wonderful maintenance that people should do. And finally, my last tip here is dark chocolate. Now, don't eat too much of it. Again, there's sugar, but not as much as the milk chocolate. But I love this quote from David Wolfe where he says, "Chocolate is an extraordinary source of key stress-fighting minerals, including magnesium, iron, chromium, vanadium, copper, zinc, manganese, and phosphorus. And these minerals favorably influence a woman's hormone system, which explains why chocolate has always been considered important for a woman's monthly cycle." See, because chocolate has many benefits. If you get 70% of cacao and up, it would be very great for you. And it can contribute to hormonal balance because of the magnesium and the iron. It can also lower cortisol and boost mood impacting hormones, serotonin and dopamine. So if you are craving chocolate, that's because you're low in the magnesium, the iron. You can purchase Shell from Genesis Botanical Formulas. That is a nice iron, and even magnesium. Be careful of certain magnesium because it can make your bowels a little bit on the looser side. But again, chocolate can lower the cortisol if you're stressed out. It can boost the neurotransmitters, having, you know, better mood. Also help with sleep. And if you just have just 6 grams of 70% cacao chocolate bar daily, it will do the trick. However, you may want to try to get more of those nutrients in your food. At least you now know what the nutrients are that are missing if you're craving the chocolate. Usually when you're having those cravings, if you're premenstrual, then that's basically telling you what you're missing or what you're overdoing, such as sugar. So you have to always be aware and think about your lifestyle, because the problem I see is people are not aware. They don't even know what they had for breakfast 2 hours before. So if you could probably make sure you know what you're putting in your body and just start to evaluate, look through things, that's a great start with starting to balance your hormones. So finally, you know, that's basically the end of my brief masterclass. I will be doing some more webinars, some more topics. A lot of people are interested in boost the immune system, the happy gut during the holidays, managing stress, which is very important, especially during this pandemic, and some upcoming webinars or masterclasses, courses. Something that's near and dear to my heart, post-cancer recovery from survival to revival. Digestive health is very important, gut hormone connection, and a series of holy hormones. Now today was just more of a general, and I'd like to focus on menopause, perimenopause, fertility, and also dealing with stress. The fatigue fix, depression, anxiety is also very important. And head over to genesisbotanicalformulas.com. Check out my products. If you have any questions, feel free to also email us. You have our email at the bottom down here. info@LAHHC right here down at the bottom. And you can find us at lotusacupunctureclinic.com. And if you mentioned that you watched the Holy Hormones masterclass, you and you're interested in functional medicine, just an evaluation, you get 25% off of the total value of the functional medicine discovery call that I have with all my new patients that are interested in functional medicine. Also, this does not include any percentage off of testing. So again, thank you so much for tuning in. Thank you for watching. And I hope that Holy Hermones Masterclass was helpful and you learned a little bit. And if you're interested, feel free to give us a call at 757-431-0053 to schedule an appointment, or even just talk to us about, what we have to offer. And it was an honor to teach and explain many things about hormonal balance today. Again, my name is Dr. Jayne Dabu, and it's been a pleasure. Bye for now.